Hey there, welcome to another episode of the Health Tech News brought to you by Medicine Tech. I have super amazing updates for you this episode. So without wasting time, let's begin. Welcome back. First on the news, Ahmadu Bello University, ABU Zaria, has secured a £5 million European Union grant to develop AI microscope for diagnosing parasitic diseases. Okay, this sounds like an interesting update to me, but let's take the news in detail. Ahmadu Bello University, ABU Zaria, has secured a £5 million grant from the European Union's Horizon Europe EDC TP3 program to develop an AI-powered microscope for the diagnosis of parasitic diseases, including malaria, African trypanosomiasis, leishmaniasis, and filariasis. This sounds interesting to me. It's no longer news that we are in an AI era where a lot of innovations are happening all over the world. Now, for this to be coming from a federal university in Nigeria makes it more exciting. So, to find out more about what this innovation looks like, you can visit the Ahmadu Bello University website to get all the details. Meanwhile, the name of the project for this innovative solution is Multiplex AI. This model aims to enhance early detection of parasitic infections in underserved and remote communities across Africa through artificial intelligence and smartphone AI-enabled tools. Again, this is exciting. Coming from a federal university in Nigeria, kudos to ABU Zaria. And I hope that other universities in Nigeria will see this as a motivation to contribute to the health tech industry. So yes, that's the update from ABU Zaria. Now, let me unveil what I have for you in the second news update. Next on the news, Seun Mafa builds 5 Africa health tech solutions and challenges the Japa narrative. Before I get into this news update, if you are in Africa, the word Japa should not be new to you, right? If it's something you're hearing for the first time, go check it out. Especially to Nigerians, this is not a strange word. Well, let's go back to the news update. As thousands of Africans continue to seek better opportunities in their abroad, in the wave known as Japa, one Nigeria in the diaspora is building reasons to come back. Now, who is this Nigerian? His name is Seun Mafa. Seun Mafa, a US-based tech entrepreneur and healthcare innovator, has launched IG9Health, a health tech firm designed to provide Nigerians with easy access to reliable diagnostic tools, including pregnancy tests and malaria strips, which are basic but essential products often out of reach for many due to cost or availability. Now, the goal of Mafa is very simple. It is to eliminate guesswork in healthcare and reduce the dependency on expensive hospital visits for conditions that can be diagnosed affordably at home. So for over a decade, Seun Mafa has worked in the US developing digital health system, compliance platforms, and remote work tools. But his long-term vision has always been rooted in Nigeria creating infrastructures that empower citizens without requiring them to leave the country. And this is truly beautiful because if we have everything we need in the country, if young people have an enabling environment where they can create solutions in the country, they will have to go abroad to look for better opportunities. So indeed, it's something remarkable. Now, according to Seun Mafa, I have never believed that Japa was the enemy. The problem has always been the vacuum back home. We didn't build anything worth returning to. Well, if you're in Nigeria or in Africa, you can relate with Mafa on this. So let's go back to the drawing board and build solutions that can make a lot of impact in the country and cause Nigerians to be more excited to be home because there are opportunities everywhere. So what Seun Mafa is doing and what his vision is all about is truly remarkable. So kudos to you, Seun. All right, let's move on to the next update for today. Next on the news, thousands in Africa turns to Dana, the free AI diabetes assistant changing lives. Dana, a groundbreaking AI-powered chatbot developed by CureChat's, designed specifically to support people living with type 2 diabetes, is quietly becoming a lifeline for people across Africa. Well. This is another exciting, innovative solution happening in the world of health tech right here in Africa. Now, let's talk about Dana. Dana is a diabetes AI assistant that provides a clear, reliable, and private support in managing diabetes. Of course, there are unique things about this model. Dana is available 24/7. It acts as a personal diabetes educator, answering questions, sharing tips, and offering support based on American Diabetes Association ADA standards. Now, what truly sets Dana apart is the deep cultural and language accessibility. It does not only speak English, it also speaks Swahili, Afrikaans, Zulu, Hausa, and so many more languages in Africa. So yes, this is truly remarkable, and I really love that it's making healthcare accessible at the comfort of the home. So people get to, speak with an AI diabetes assistant that can give them all the support they need in managing their diabetic condition. If you want to know more about this tool and how it works, do well to check it out online. And that's it about Dana. Let's go to the last update for today's news. Next on the news, Uganda has made a move to regulate digital health and protect patients' data. The Ugandan government has finalized new digital health guidelines aimed at strengthening the protection of personal health data and regulating the growing use of telemedicine and electronic health platforms across the country. What the Uganda government has gone ahead to do is very important, especially because the world is deeply influenced by artificial intelligence at the moment. So if people's data or patients' data are not protected, their line is at risk. So well done to the Uganda government. In addition to the finalization of these digital health guidelines, Prof. Sekalala pointed out that many digital tools used for billing, lab transfers, and patient data sharing are already in operation without the knowledge of most health workers. Now, you know where the problem is coming from and why this is important. Professor Sekalala also warned that without robust oversight, patient data may be shared without consent or adequate protection. Also, according to Mr. Muhumuza, the Data Protection and Privacy Act of 2019 explicitly classifies health information as sensitive personal data, thereby subjecting it to stringent protections. He also said the law mandates that health data can only be collected, processed, or shared with the informed consent of the patient. I believe that you also agree that getting the informed consent from patients before using their data for anything is very important, whether it's AI related, tech related, or even in the healthcare generally. Patients' data must be protected. People's data must be protected. So for Uganda government to take this step to make these things legalized, I give them kudos to that. And that's it on today's edition of the Health Tech News. I hope you had a great time catching up on all these updates. Of course, I believe you did. So to ensure you don't miss out on any of our updates, whether news, podcasts, trainings, opportunities, ensure you're subscribed to this channel, right? Also do well to follow us on LinkedIn to get updates on the things happening in the world of health tech, especially if you want to build a career in the digital health industry. Medics in Tech is your go-to platform to get all the resources you need. Thank you for joining me in today's news edition. So look out for the next one and I'll be back. Bye.